Hi, everybody. My name is Dr. John Heary, and I'm coming today with a another important health topic. So today we'll jump right into it here, but we're going to talk about the silent killer, high blood pressure. Um, you know, High blood pressure, like I said, it's often referred to as the silent killer, and the reason that is that virtually most of the time it has no symptoms, but it has one of the greatest risk factors for stroke, for heart attack, and even death. About 1 in 3 American adults have high blood pressure, also known as hypertension. And according to the Center for Disease Control and Prevention, the CDC, high blood pressure, it's the second greatest public health threat in the United States. So, what I want to do is go over exactly, what blood pressure is. Blood pressure is the result of the heart muscle contracting, which produces the force needed to move the blood through the arteries. Okay. So, blood pressure is usually diagnosed based on consecutive elevated readings. So you don't want to consider yourself to have high blood pressure based on one reading. Now the readings they're usually given in a fraction form of systolic blood pressure, which is the top number, over the diastolic blood pressure, which is the bottom or the lower number. Now, the systolic pressure indicates the blood pressure when the heart contracts. Okay. Diastolic pressure is the pressure put on the heart or the arteries between your heartbeats. Now, normal blood pressure is considered to be 120 over 80 millimeters mercury or lower, while blood pressure that's above 140 over 90 is considered high blood pressure. Now, once high blood pressure has been diagnosed, the medical field's real quick to jump on antihypertensive medications, to help bring that blood pressure down. Often one or more medications are recommended in order to lower the blood pressure readings. And one of the questions need to ask is medication truly needed in order to regulate blood pressure levels? And the answer is no, because many studies show that most of the time the side effects are worse over time with the medication. Okay, and I want to share something with you that Sherry Rogers, MD, describes what happens when a patient is put on diuretics as a way of lowering the blood pressure. Now, um, diuretics are class medications that reduce water and salt, thus lowering the total volume of the blood flowing through the vessels, which lowers the pressure. And it's the same way of you're turning down your spigot, which reduces pressure in a garden hose. One of the most common diuretics is called hydrochlorothiazide. Now, unfortunately, diuretics, they may also create imbalances, such as depletion of potassium. For some patients, an improper diagnosis or of potassium deficiency is often the underlying cause of high blood pressure. So taking a medication that silently lowers the potassium even further leads to high blood pressure and guarantees the need for even stronger medications in a few years. So, blood pressure medications have other side effects that contribute to kidney and liver disease and even diabetes and heart arrhythmias as well. So, this leads to the question is are there, ways to lower blood pressure naturally and avoid hypertensive medications? And, the answer is a resounding yes. So what I want to do is I'm going to go ahead and I'll list a few ways that you can, a few things that you can do to help keep or, bring the blood pressure, lower blood pressure. Um, one supplement that does help and work very well. It's a homeopathic supplement. It's called Formula 303, and Formula 303 consists of there's a few things in it, but it has valerian root in it, passiflora, magnesium. It's suggested that if you're experiencing high blood pressure, to take at least 2 tablets every hour until the blood pressure returns to normal. Okay. Um, you can also drink at least 2 glasses of coconut water each day. Coconut water is richer, it's high in potassium, magnesium, and also in vitamin C as well. There is a study that was conducted by the West Indian Medical Journal, and that showed that coconut water caused a 71% decrease in systolic blood pressure and a 29% decrease of the diastolic blood pressure. Now, another supplement that's good to take when you have high blood pressure is called ubiquinol. Ubiquinol is the active form of coenzyme Q10. Ubiquinol is one of the most critical components of cellular respiration and the production of ATP, cellular energy. Supplementing with magnesium. Magnesium is an electrolyte that's used to reduce muscle cramps, nervousness, restlessness, and insomnia as well. Magnesium is essential for muscle function. It's responsible for moving calcium and potassium into the muscles where it's then used to control and contract the muscle fibers, including heart muscles. Um, Now, another thing that is important that you want to do is increase your physical activity. All right. Your goal should be to have, when it comes to cardiovascular activity, shoot for about 30 to 45 minutes a day. Exercise does help reduce high blood pressure, and it doesn't necessarily need to be strenuous. If you're overweight, if you're unfit, a simple walk around the neighborhood or walking up and down stairs, it's a good place to start. You want to make sure that you're starting with something that your body can handle. Okay, so you don't want to overshoot it. You also want to make sure that you reduce the amount of alcohol that's consumed. Excess amounts of alcohol can have a negative impact on your heart, on your liver, on your pancreas. Also, if you smoke, you've got to stop. Okay, so no smoking, no use of tobacco products. Tobacco products, they cause damage to the heart and arteries. It can also elevate the heart rate. You also want to reduce daily stress and stressors. Um, Good things to do here: yoga, acupuncture, chiropractic adjustments, deep breathing exercises. All of those have been linked to reducing stress and anxiety levels. You also want to make sure that you get nutritional blood testing done. It can be used to see if there's underlying causes of high blood pressure. Lab testing can show, if there's any signs of anemia, infection, inflammation, or heavy metal toxicity. All of these can lead to high blood pressure. So, if you're curious, to see, where you stand with your health and blood pressure, um, sometimes the natural solution to high blood pressure, it's very easy, to figure out what to do once you have the proper testing done. So, I hope that helps and hopefully, gave you some great information today. Um, we'll look forward to talking to you soon. Okay, take care, guys. Bye.